This training covers strict protocols that protect our service users from medication errors, overdoses, and underdoses. Every procedure you'll learn has been designed to ensure the highest standards of care whilst maintaining our service users' welfare and safety. MoralCare has a unique and extremely effective medication monitoring system. The deputy manager is responsible for all GP referrals, medication reviews, ordering, medication management, and deliveries. For the deputy manager to do their job, you have an important part to play. Whenever there's been a medication delivery at a service user's home, you need to do a stock count of that medication and submit the new stock number to the office. To do this, you add the stock that has just been delivered to the current stock levels. Submit this new total through the app so the deputy manager can update their ordering spreadsheet. This spreadsheet will then alert them when the medication is due to be ordered again. We have numerous safety measures in relation to medication administration. Carers must always witness any medication given. This prevents service users from saving up medication to potentially harm themselves, or forgetting to take medication, or even accidentally dropping medication. Missing medication can be just as harmful as an overdose. Another main safety policy we have is that carers must only administer directly from manufacturer boxes with sealed sleeves or pharmacy-sealed blister packs. This is because they are sealed by medical professionals and both clearly indicate what medication is packaged. Carers must never administer from dosette boxes for reasons such as we don't know what tablets are in them, if they're expired, if they're correctly prescribed, or even if the family has filled them with cyanide. Obviously, that's an extreme example, but one to consider. You must pay particular close attention when administering from blister packs. If you're rushing, it can be easy to make an error. You could easily presume that the top row is morning, but that depends on which way up you hold it. It's vital that when administering from these blister packs, that you are popping the correct day and the correct time of day. Blister packs must be popped in precise order so it can easily be seen if there has been any medication errors. For example, if windows were popped all over the place, it would be hard to see if a service user has popped more medication after the carer has given it, or if an incorrect window has been given. Plus, doses can vary over different days. Only use one blister pack at a time, as multiple open packs can become extremely confusing. If you are opening a fresh pack, make sure to check that there is no other one on the go before you open the first window. When signing for a blister pack, you must check the prescription stickers match with the medication record you are signing for. Avoid popping a blister pack window and just signing for whatever medication appears on the medication record at that time, as this could cause serious oversight. Every time you give someone a medication, it is crucial you read and check the labels to ensure you are following the correct instructions and it matches to the medication record. You should always check the label and medication record to check you have the right drug, the right dose, the right direction, the right time, and the right person. This is important to do for every drug, every time, no matter how often you go to a person. Errors can easily be made by being on autopilot. You don't want to give medication incorrectly, as this could have serious consequences to the person's health. Medication isn't always plain sailing. Sometimes things can change, such as medication stopping or dosage increases or decreases. A serious error could happen if you give medication on autopilot. Just think of this scenario. Someone is taking 215 microgram codeine. The doctor reviews this medication and increases the dose to 45 micrograms and changes the script to now just one 45 microgram tablet a day. A new box arrives at the service user's property of 45 microgram to take just one tablet a day. If you don't do your pre-administration checks, you may miss the dose change on the medication record or on the prescription label. Going on autopilot, you then give 2 codeine tablets as usual. This oversight has now caused the person to have two 45 microgram tablets when they are only supposed to have one. This could result in a hospital emergency visit for urgent intervention. Autopilot can cause harm, so ensure you do your pre-administration checks for their safety every time. If you do make an error, you must report it to the office straight away. We will not judge or scorn you. We just want the service user to remain safe. Overdose or underdose are both dangerous.
Understanding a prescription label. This is the quantity in the box before opening. This is the name of the medication. This is the drug dose. This is the drug form. In this case, it's in tablet form. This is the direction. Read this carefully. For instance, if you glance at this, you might see the number 8 and think it's 8 tablets to give. But if you take a moment to read and understand the instruction, it's 1 tablet every 8 hours. This is the name of the patient. Be careful not to get husband and wife medication mixed up. This is the date it was prescribed. Do not confuse this with an expiry date. Expiry dates are usually engraved on the side of the manufactured box and not on the prescription label itself. This is the name and address of the pharmacy that dispensed the drug. You must not administer from a box if the label is not readable, as you won't be able to do your pre-administration checks for the right drug, right dose, right direction, right person, right time. It's good practice to check the sleeves match the medication name and dose on the box, just in case an incorrect sleeve has found its way in the wrong box. The reasons we read medication labels and not the brand on the box is because this can change. For example, if someone is prescribed 200 microgram of ibuprofen, this may be delivered in a range of different brands and colours, but the drug and prescription remains the same. If you look for a red box, you might think it's out of stock, when actually it's just been delivered in a different brand. You've just got to look for that prescription label dot. If you are ever unsure of anything to do with medication, seek help from the office straight away. Don't just guess if you are ever unsure about someone's medication. You should always check the prescription label matches the app's medication record. Sometimes medication may not have a prescription label on because it is OTC approved. OTC stands for over-the-counter. Over-the-counter medication is for items that cannot be prescribed or that the service user has purchased by themselves. These will be on the medication records and state that they are OTC approved. Any medication that doesn't have a prescription label on must go through our OTC procedure. This procedure means for an office member to call the person's pharmacist or GP to check that the over-the-counter medication is fit for purpose and can be taken alongside the person's current medication list. You must never give any medication that is not listed on the medication administration record to give, even if the service user requests you to. If the service user requests you give them a medication not on the medication list, notify the office so the OTC procedure can take place and it be added to their records.
Every service user is different. Some may want us to fully administer, some may want us to prompt, and some may want to manage their medication entirely themselves. Administration means taking full responsibility for the medication, preparing and witnessing the medication. Prompting means reminding and guiding the service user to take their medication, but the carer does not intervene or take responsibility. Self-managing means the service user wants to take their own medication by themselves. Carers must report any concerns if they think the person is not managing this or struggling with it. When preparing for medication administration, you must wear clean gloves. You must have clean and dry vessels ready. Making sure they are dry is important, as wet medication pots could remove the protective coating of tablets or stick them to the bottom of the cup, which could cause missed medication. If you need to use syringes for administration, make sure that they are clearly marked for measurement. Sometimes repetitive washing can cause the markers to wash off. You should have a glass of clean, fresh water ready for the service user to take with their medication. Hot drinks like tea can cause medication to start dissolving while it's still in the mouth. Before starting to do your medication administration, ensure you are free from distraction and interruption. Don't try to multitask whilst preparing medication. Medication can be taken by different routes. Oral, swallowed by mouth. Sublingual, under the tongue. Buccal, dissolved in the cheek. Peg tubes, via tube to stomach. Transdermal, patches on skin. Topical, absorbed through skin via creams and ointments. Nasal, absorbed via nostrils, such as nose spray. Otic, administered via the ear, such as eardrops. Octic, administered via the eyes, such as eye drops. What is PRN? PRN is an abbreviation for the Latin term pro renata and means as needed. Medications are PRN when they are prescribed to take as needed or when required. Drugs that are usually PRN are things like paracetamol, ibuprofen, and bowel stimulants. When something is PRN, you must ask the service user if they require it. For example, if it's paracetamol, you would ask the service user, "Are you in any pain?" Or if it's a bowel stimulant, you would ask if they need any help to open their bowels. If someone does or doesn't need a PRN medication, write in the medication note section the reason why it was or wasn't needed. Do not stop asking or offering someone PRN medication just because they usually decline it. This could deprive them of it at a time when they actually need it. If someone lacks capacity, you may need to assess the person yourself. If it's a bowel stimulant, see when they last opened their bowels. If it's pain relief, observe for signs such as behavior changes, grimacing, or flinching that could indicate pain. Correct medication documentation is extremely important. If something happens to that person, whatever you have signed for must be what is in that person's system exactly. Medication comes under a strict duty of care, and you could get in trouble if you falsify medication records or make an error that has caused harm to someone. When it comes to documenting, it must be precise. If you select you have administered and witnessed something, make sure you have witnessed it. If someone is prescribed a medication, it's important to encourage it to be taken unless there's evidence of negative side effects. PRN medications are slightly different. Someone cannot refuse a PRN medication, but they can decline it. This is because it's optional. When documenting a PRN medication that isn't needed, the correct response is not required. You should encourage the use of PRN medication in the event that it is needed. For example, if someone is in pain, constipated, or has diarrhea. If someone doesn't want a medication that is not a PRN, this would be classed as a refusal, as the doctor's direction is for them to take it, once a day, for example. There's nothing in that instruction that suggests it's optional. Whenever you don't give a medication, whether it's because it isn't required or has been refused, make sure you document in the medication notes the reasons why. For example, Bob declined PRN paracetamol as not in pain, or Bob refused ferrous fumarate because he feels sick. We are not prescribers. We must administer medication only as exactly advised and prescribed by a doctor, nurse, or pharmacist. We are not qualified to meddle with prescriptions or give people advice on medication or conditions. Covert medication is when medication is in a disguised format to trick someone into taking medication. This should never be done unless specifically stated in someone's care plan. This would only be implemented formally if the person lacks capacity, and it is in their ultimate best interests to have the medication. Putting medication on a spoonful of yogurt to support with swallowing is not covert as long as it's not hidden from the service user. If you think someone has an infection, it is important you report this straight away, as infections need immediate treatment or antibiotics. Antibiotics are for a short course only to treat the infection. If you think someone needs antibiotics over a weekend, call out of hours and let them know so treatment is never delayed. Do the same if antibiotics have arrived over the weekend, so the office can add the antibiotics to the medication record and treatment can commence. Signs of infection are confusion, redness, discolored urine, temperature, crackling chest, and shaking. When someone completes a course of antibiotics, they become at risk of C. diff, which is a dangerous and nasty gut bacterium. Symptoms of this would be foul-smelling, mucus, and jelly-like stools. If you notice these signs, report it immediately. It is contagious through fecal spores, so wear your mask, apron, and gloves around the person until you get authorization to stop. If they do have C. diff, they will need to have another specialized antibiotic to be cured. Keeping medication tidy and organized is important to ensure streamlined administration. Additionally, unorganized and untidy medication can easily lead to errors, not to mention make medication administration stressful for yourself and your colleagues. Though the stock should be neat and organized, do not merge strips of what appears to be the same medication into the same box to reduce the number of boxes. This could cause the incorrect strips to be merged together and cause not just a one-off medication error, but team-wide errors. A controlled drug is a substance whose production, sale, and use are restricted by law because of its potential for theft, abuse, or harm. These substances are put into different categories or schedules based on their medical uses and risk of abuse, with strict rules. Examples are morphine, codeine, oxycodone, and fentanyl, all of which are carefully regulated. When a medication is a controlled drug, you must take extreme caution when administering, ensuring no errors, as these errors could cause the most harm. Check controlled drugs twice. You must always monitor stock levels, ensuring no suspicious activity. All stock must always be accounted for. Controlled drugs that go missing is a police matter. Medication must always be stored correctly, in accordance with the medication storage requirements and care plan. People who are at high risk of overdose, be it from intentional suicide ideation or from accidental overdose, for people with severe memory issues, medication may be kept in a safe. It's important you don't share this code with anyone, including the service user, and that you ensure the safe number remains confidential and protected from sight. Make sure you spin the numbers once finished, so the service user cannot open the safe once you have left. In the interest of organization, medications are stored neatly together. However, some medications may be required to be kept in the fridge, such as some creams or eye drops. Or some creams may be kept by the toilet, as they are used after a bowel motion. If medication is not stored with the usual stock, it should state this on the medication notes of that specific drug. Medication should be stored away from heat, moisture, and direct sunlight. All drugs should always be stored out of reach of pets and children. Even if the service user doesn't live with children or pets, they may visit at any time. All medication is important. Let's think of a medication that doesn't seem like that much of a big deal, lactulose. It only helps you go to the toilet. It isn't going to kill you if you didn't have it, right? Tell that to Elvis Presley. He died from a heart attack on the toilet. His body was found undignified, quite literally bottoms up on the toilet. His heart was put under such severe strain due to his untreated constipation. You must never flush medication down the toilet, down the sink, or put medication into the general waste. This would cause environmental damage. Medication must be disposed of in accordance with regulations. Tablets and capsules must be disposed of via a blue medication bin or returned to any pharmacy for destruction. Needles must never be disposed of in the general waste, as this would risk needle stick injury. Needles should also never be resheathed by hand, as this is high risk of needle stick injury too. Lots of modern-day injections are now built with self-sheathing abilities to reduce this risk. Needles must be disposed of in yellow bins provided by the pharmacy. The pharmacy will usually collect these bins for safe disposal. Do not overfill a sharps bin. The office works closely with local pharmacies and online pharmacies. Sometimes you may be required to collect medication between visits as needed, especially if someone needs to start antibiotics without delay. Medication can sometimes be delivered by local delivery drivers or via Royal Mail if their nominated pharmacy is an online pharmacy. As a carer, you don't need to order medication, but if medication is running dangerously low, alert the office. If you find a service user is struggling to swallow medication regularly, let the office know as soon as possible. Alternative medication can be prescribed, such as medication in liquid form. This will help the person swallow their medication and reduce the risk of aspirating on medication. If someone spits tablets out or vomits, never re-administer a fresh tablet for 2 reasons. Reason 1. You don't know how much of the medication has been absorbed. As soon as a tablet touches the tongue, it starts to work, and we can't measure how much is already in the person's system. Reason 2. Administering another tablet would disrupt the stock totals, and the pharmacy won't deliver any sooner than expected or replace a missed tablet. If you find any tablets on the floor, report it to the office.
Supplements can be prescribed for weight gain or nutrition deficits. This could be Complan or FoodLink, which can be mixed as a milkshake or added to food like porridge. They come in different flavors. Other types of supplements could be FortiSip or FortiJuices, which are like a flavored drink. If someone is taking supplements, it would also be wise to consider fortifying their diet, such as using full fat products to promote weight gain. You must never apply cream unless it is on the medication record. Remember, creams are a medication just absorbed through the skin. Pay close attention to the instructions, as some need to be applied sparingly and some liberally. Emollient cream, such as Epimax, must not be stored near heat sources, as they are extremely flammable. Some creams may have specific storage instructions, such as storing in the fridge. Some creams may need to be disposed of 1 week after opening. Whenever you open any cream, write the date of opening on the label. Always wear gloves when applying cream so you don't absorb any of the drug into your own skin. Change your gloves before and after application. This is especially important with creams like ibuprofen gel, as it can burn. The most common type of medication is in tablet or capsule form. You mustn't tamper with a medication's intended form, such as opening capsules, crushing tablets, or cutting tablets in half unless authorized by a GP or pharmacist and clearly stated on the medication record. This is because this could significantly change how the medication works, reduce its effectiveness, or cause damage to the stomach. Some medications have special coatings on so they disperse at a specific time after being swallowed. Just because this has been authorized for one service user, it doesn't necessarily mean that you can now do this with this medication across all service users, as each person and strength and prescription intention is different. We would need to seek clarification for each individual person and medication. Make sure to take medication with water, as hot drinks can affect how the medication works. Some service users can have patches. Whenever you apply a patch, you must write the date of application on the patch itself. Rotate the patch around the body and never apply the patch on the same area. Avoid touching the sticky part of the patch, as this will be laced with medication. You don't want it transferring onto your gloves or fingers. When removing an old patch, fold it in half so it can then be disposed of in the usual waste. Folding it in half will prevent it from sticking to someone else accidentally and also prevent someone from retrieving it from the waste to reuse. Make sure old patches have been removed before applying a new one, as this would be an overdose. There's a lot of different inhalers available. Remove the cap and shake vigorously. Ask the service user to breathe out gently, not into the inhaler. Place the mouthpiece between the lips and create a good seal. Press the canister down whilst the service user breathes in deeply. Essential tips. Use spacer devices when provided. Take your time. Never rush the process. Clean the mouthpiece with a tissue after use. Oxygen tubing can cause trip hazards. You know how easily tubing can get twisted under a chair leg or caught in a bed rail. This could also impact oxygen flow. Keep an eye on it. Make sure those nasal cannulas are sitting comfortably, not too tight, not slipping off. If you see any cracks or the connections look loose, sort it out gently. People are prescribed an oxygen level. Avoid knocking the knobs and only touch these if you are actively changing the oxygen rate as per care plan. Check what's written in the care plan matches what you see on the machine. If something looks off, don't guess. Call the office straight away. Oxygen and heat sources are a deadly combination. Radiators, gas fires, electric heaters, even someone's cigarette 2 rooms away. Keep everything at least 2 meters apart. I know it sounds like a lot, but house fires with oxygen equipment, well, let's just say we never want to go there. Don't use anything oil-based near oxygen equipment. No Vaseline, no hand cream with petroleum. If an alarm goes off or someone's struggling to breathe, that's your cue to act fast. Eye drops. First things first, those dates matter. As soon as you open a new bottle of eye drops, grab a pen and write the date on the label. Most eye drops only last about 28 days once opened, some even less. It's not about being fussy, it's about preventing eye infections. Old drops can actually make things worse. Now the technique bit. Get your service user comfortable, maybe sitting back in their chair. Gently pull down the lower eyelid to make a little pocket. That's where the drop goes, not directly onto the eyeball. 1 drop is usually enough. If they blink and it goes everywhere, don't worry, have another go. Storage. This is important. Some eye drops need to go in the fridge. It'll say so on the box or your care plan will mention it. Others are fine in a cool, dry place. Just check what you're dealing with. And here's the golden rule. Never let the tip of the bottle touch the eye or eyelid. That's how you get contamination, and nobody wants an eye infection. Quick safety check. If someone's eyes look red, swollen, or they're complaining of pain after using drops, stop and call your supervisor. Sometimes people can react to medications. Document it properly. We had time, which eye, any problems or concerns. Eardrops. The technique. Get your service user to tilt their head to one side, affected ear facing up. For adults, gently pull the ear up and back to straighten the ear canal. Then squeeze the drops in. Don't jam the dropper right in the ear, just let the drops fall in naturally. After the drops go in, ask them to stay tilted for about 5 minutes if they can manage it. Some people like to put a small piece of cotton wool just at the ear opening, not pushed in, just resting there to catch any overflow. Same rules as always, write the opening date on the bottle. Most eardrops last about 28 days once opened. Never let the dropper tip touch the ear. That's contamination waiting to happen. Watch out for, if someone complains of increased pain, discharge, or their hearing gets worse after using drops, stop and call the office. Document it. Which ear, how many drops, any issues. Job done. Pile and hemorrhoid cream. This is really personal care, so make sure you've got proper privacy. Curtains drawn, door closed. Explain what you're doing and get clear consent before you start. Always wear gloves. Most pile creams come with a small applicator or you'll use your gloved finger. The area needs to be clean first, gentle washing with warm water and patting dry. Application technique. Apply a small amount around the anal area. Always be gentle, this area is already sore. Help them get comfortable, dispose of gloves properly, wash your hands thoroughly. If you notice increased bleeding, severe pain, or any signs of infection, stop and call the office immediately. Document it properly, time applied, any observations, how the service user tolerated it. Look, I know it's awkward, but for someone in pain, you're providing real relief. Near-miss reporting is about learning, not blame. What's a near miss? It's when something could have gone wrong but didn't. Maybe you nearly gave medication to the wrong person but caught yourself, or you spotted a loose carpet that could have caused a fall. No harm done, but it was close. Here's the thing, we want to hear about these. Every near miss is a learning opportunity for all of us. When you report it, you're not admitting failure. You're helping prevent the same thing happening to someone else. That's actually pretty heroic when you think about it. Our culture here is simple. We learn together, we improve together. No finger pointing, no blame games. Just honest conversations about how we can do better. Tell the office straight away. Be honest about what happened and what you think might have prevented it. We investigate everything properly, not to catch people out, but to understand and improve. Remember, the person who reports a near miss is often the person who prevents a serious incident down the line. That's the kind of team member we value. Your voice matters. Your observations keep our service users safe. Don't keep quiet, speak up. Spotting adverse reactions, trust your instincts. First thing, you know your service users. If Mrs. Johnson is usually chatty and suddenly she's drowsy and confused after starting new tablets, that's your alarm bell ringing. Trust what you're seeing. Common signs to watch for: skin reactions, rashes, swelling, itching that wasn't there before. Breathing changes, wheezing, shortness of breath, tight chest. Stomach issues, sudden nausea, vomiting, or severe stomach pain. And mental changes, confusion, agitation, or unusual drowsiness. The serious stuff, act fast. Difficulty breathing, severe swelling, especially around face or throat, unconsciousness, or severe allergic reactions. Don't hesitate. Call emergency services immediately. Document everything. What you saw, when it started, what medication they'd taken. Remember, you're often the first person to spot these changes because you see our service users regularly. Your observations matter. They could prevent a serious medical emergency. Here's the reality. Medication management isn't just about pills and potions. When you help Mrs. Smith with her heart tablets, you're literally keeping her heart beating strong. When you support Mr. Jones with his inhaler, you're helping him breathe easier and stay independent in his own home. You're not just following procedures, you're changing lives. Every time you double-check a dosage, every time you notice something's not quite right, every time you take that extra moment to make sure everything's perfect, you're being someone's guardian angel. Yes, it's serious work. We handle medications because they matter. You've got the knowledge, you've got the procedures, and most importantly, you've got good instincts. Trust yourself. You know your service users. You spot the changes others might miss. That connection you build, that's your superpower. Use it. Don't be afraid, be confident. We wouldn't trust you with this if we didn't believe in you completely. You have what it takes to do this safely and brilliantly. So go out there and make a difference. Keep those eyes open, trust your training. That's what moral care is all about. That's what you're all about.